the typical complaint that we're kind of focusing on is yeah, they tend to localize it to the region of the neck. And there was a woman, young woman, maybe in her early 40s, who came and had sort of a progressive change in her swallow, but had said that it was primarily solid foods. And in her history, it was pretty benign, except for the fact that she'd been diagnosed with a rheumatoid arthritis. So she'd been followed for a few years for that. And we did a video study, and basically she did have residual above the upper sphincter, but normal hyoid elevation. So it wasn't a really pulling problem. So then you start to think, well, is it neurologic, you know, a relaxation issue? But that wasn't there. There was, so you did your physical exam. She didn't admit to any changes in neurologic status. So the next thing that you sort of want to think about is, well, maybe we're missing something in the third stage. And as you, and so, you know, the way we sort of evaluate that in a patient who can stand is you kind of look AP. And it's important to say that for everybody that this is just a screening of, it's not the best esophageal exam, but in this case it brought up the obvious problem that she had really total dysmotility in the esophagus, and it was probably overlap syndrome. Went back to the rheumatologist, and in fact it was she got scleroderma as a diagnosis. And unfortunately there's not a lot you can do for that as an issue, but still it explained her symptoms.